that.
Okay.
This is FX Medicine. I'm Andrew Whitfield Cook. We're at the 2019 UIC Medicinal Cannabis Symposium in Tweed Heads, and I'm here speaking with Judith Lacey, who works at the Chris O'Brien Lifehouse in New South Wales. And can I ask you a little bit about your history, your medical history, and what you're in charge of?
Sure. So I am a doctor of medicine. I studied at the University of New South Wales and finished my degree in the 80s, just before the endocannabinoid system was discovered, so in 87. And I am the head of integrative oncology and supportive care at Chris O'Brien Lifehouse. I did my training in general medicine, and then I went on to re-specialise in palliative care. And over the last few years, I've been working as in the space of supportive care and integrative oncology, so keeping people living well with cancer, using broadening the toolbox of how we keep people well with cancer, so using complementary therapies and developing research and evidence to support the use of complementary therapies and supporting people throughout their cancer journey from the time of diagnosis through to end-of-life care and into survivorship. And cannabis fits very comfortably in that space.
How long have you been using medicinal cannabis for? When I say using, how long have you been employing medicinal cannabis for?
So I've been prescribing medicinal cannabis.
That's
and
the word.
Been involved in this space really since I started at Lifehouse. I think, as you know, Chris O'Brien Lifehouse was one of the first centres to host and lead the New South Wales Health sponsored study in chemo-induced nausea and vomiting. And so we have a multi-million-dollar study run by Peter Grimmerson in an RCT and chemo-induced nausea and vomiting. So that started recruiting in 2016, and we realised a lot of people were very interested in cannabis and cannabis prescribing. So I naturally fit into that space and started looking at a role of prescribing medicinal cannabis for refractory symptoms for cancer patients. And it's been a steep learning curve, and I've been working in this space now for about 4 years.
What do you think's great about having access with the SASB, and do you think we really need to move to a different model, or do you think it's appropriate?
I probably have a very skewed view of cannabis prescribing. I like the new online SAS Cat B model. I like the fact that I have an understanding of what I can prescribe for, and I have conversations with my patients. The new system, it started off very clunky, the whole system, but now the new system, I can write a script in a few minutes with the patient in the room, once I've done a 1-hour consultation with them to see if they qualify.
Yeah.
And usually within 2 days, the approval's through and the product is in my pharmacy. And so it's really understanding the system. I'm not an authorised prescriber, and I think that's quite a limiting system for me. I don't use the SAS Cat A because that's irrelevant for my population. But of the patients that I see, and it's about 30% of my total practice, I looked at my stats just at Lifehouse because I work over 2 sites, so I also work at St George Private Hospital.
Yeah.
About 45% of patients that will see me about medicinal cannabis, I will have qualify for a script using the SAS Cat B, and then I continue to see them regularly. So the SAS Cat B actually gives me the online system gives me a structure where I've got all my records kept. I know what I've prescribed. I can clone the applications and change them, so it's faster, and it's actually improving regularly. Yeah.
And acceptance by the patients with regards to, just the acceptance in delivery method of the medicine and costs, those sort of...
it's expensive. It's... And the expense is relevant because cancer is a financially toxic illness, and people with advanced cancer, and these are the patients I'm prescribing for, they can't work, and many can't afford a product. But having said that, it's much cheaper than a lot of other things that we prescribe.
Right.
And there's opportunities to be involved in research which will enable free products to be delivered to the patients, and that's where and that's something that I'm increasingly involved in.
one of the issues you'll be covering in research is tolerability. How do you find the tolerability?
So, as you know, I'm involved in, or you don't know, but I'm involved in 2 studies. And
That's where we're heading.
So when it comes to prescribing, and I've prescribed for about 70 patients now, and I'm looking now at all my data to see who, they have to keep a daily diary, or I ask them to keep a daily diary, and then fill in the Edmonton Symptom Assessment Score, which is a validated tool in people with advanced cancer of their symptoms. So I can get a sense of their symptoms, their side effects. Tolerability is generally quite good, but really to understand how people who are very vulnerable and very frail tolerate different cannabis products is of interest. And so the 2 studies that I'm involved in, the first one which I presented today here at the United in Compassion meeting was on our study led by Janet Schloss with Justin Sinclair involved as well, which is a study on the tolerability of 2 cannabis products for high-grade gliomas. So these are very highly malignant, very poor prognosis cancers, to see, first of all, do they tolerate the product? Does it improve their symptom control and their quality of life? And does it potentially have a benefit on the on slowing the disease progression? But does it give us some signals that will then inform a really well-structured randomised control trial? So that's one tolerability study I'm involved in. The other is a study which New South Wales Health have actually sponsored, and this is through the Acre Centre, and I never remember the name, led by Jen Martin, and there's a group of 12 of us, I think that is, of clinicians and researchers in the field of medicinal cannabis looking at a prospective study of prescribing different cannabis products, and many of the people in this room today have providing their products free of charge for the study, prescribing the products that are available in Australia now for refractory symptoms in the advanced cancer population, looking at the tolerability, looking at the PK data, looking at people's symptoms, and what it will enable is it will give us really good information as to how we can assist general practitioners and other prescribers on how to feel confident in prescribing cannabis for these patients, but also get some data as to the potential benefit, the side effects, the potential addiction, if that's an issue, and so forth. And these patients will receive, if they're enrolled in the study, will receive the product free of charge from the time they're enrolled in the product, as long as they remain eligible to stay on the study until they die. And so that's going to be quite an exciting space to be involved in. And we're going to be starting it in the area of the greatest need, which is rural and remote Australia, and working with the GPs. And I think what is lacking in this space, you know, I'm prescribing, but it's not feasible for me to be the only prescriber in the area that I'm working in right now, because I've got a long wait list and it's not sustainable. What we really need to be doing is educating doctors and nurses and nurse practitioners to feel confident in prescribing and understanding the nuanced way of prescribing and even basic prescribing at the moment. And that's how I've learnt, and it's not rocket science. And that's where we're heading.
Okay, so I mean, that's fantastic that we're now getting that work. So we're getting the interest from the GPs. We're getting the research funded by the New South Wales Health. That's awesome. We're still getting problems with access. So where's the blockage?
The product is in Australia. So there's no lack of product. So it's not access to a product that doesn't exist. The product is here. It's sitting in warehouses. The prescribing needs to be, people need to feel confident to prescribe. So in 2 weeks, Justin and I are going to Orange to run a full-day workshop for nurses and doctors working in cancer. I'll be speaking around New South Wales about how to prescribe for people working in palliative care. So it's education. I think the blockage, people are nervous. It's a new product, they're nervous, they don't understand it, it's, you know, it has a history. So I think the blockage is actually with the prescribers and not with the supply chain.
Right.
And I think the SAS Cap B process, if you understand it, is reasonable. And I think for people, everything can be improved, and I think it is going to be improved. But we need to work together to make those sensible improvements.
Yeah.
That's my...
You said product, and of course there's more than one product. You can go down a rabbit hole as to how many.
Yes.
How does one get the expertise? I mean, this is way out of the realm of GPism, when you've got a drug for a thing, for an approved listability, if you like. And then you've got cannabis. Woof. You've got a plan.
And that's why I feel comfortable in that space. I also feel comfortable in the space, I think, because of my training in palliative care. I feel comfortable working in with uncertainty.
Yeah.
It's safe medicine. It's best. Number one, do no harm. Then look at how can I reduce suffering without doing any harm. So you need to understand the interactions. And then safe prescribing and safe follow-up. So it's working in an uncertain space, but it's not... You need the expertise and to feel comfortable with understanding what you have out there to treat those symptoms. If you're saying that this person has pain, the first thing I'm going to reach for is cannabis, that's not appropriate. That person has pain, well, let's understand their pain. Let's look at the mechanism of the pain. Let's see where the pain's coming from. What drugs have they tried? What drugs haven't they tried? Is it neuropathic pain? Is it visceral pain? Is it from bone? And then saying, well, where does cannabis fit in? And ideally, what's the terpene profile that best fits that patient? What ratio of CBD, THC? What other cannabinoids do we need? That's the nuanced part that I really don't understand yet, that I'm fascinated by. But it's looking at, and then once we provide... start people on cannabis, how can we reduce all the polypharmacy and how can we improve the quality of life for our patients? So it's an exciting field, but I think people just need to, come to our sessions and learn about it.
Of course, other important work that you do at the Chris O'Brien Lifehouse, and I don't know how much your personal involvement is, but some things that they have involvement, there is interventions which can help their mindset, which can also have a very dramatic effect on pain. So can you tell us a little bit about what sort of things are employed at the Chris O'Brien Lifehouse? What sort of things
So I've got 27 practitioners in my department, and we look at and we work as a multidisciplinary team, and we look at a holistic way of improving the quality of life of patients. So we have mindfulness practitioners, yoga, oncology massage, acupuncture, reflexology, exercise physiologists. Everyone needs an exercise program, nutritionists, psychologists, counsellors, and reflexology. And we look at, and then the safe use of herbs and supplements, and we look at how you package this for the person to have a personalised, supportive environment to improve people's life with living with cancer. So it's very exciting. So exciting.
It's so exciting. 27 people herding cats. But where do you think we're going? Where do you think that fits in with standard oncological care in Australia? Do you think we're moving towards that?
Oh, absolutely.
Patients want it, but there seems to be this...
It's actually... The importance is integration. And so we're actually having a meeting in the 1st of May. The the person who founded MD Anderson's service is going to be speaking in Sydney at our... Look out for the Eventbrite ad. And we're looking at how you best integrate and the important role of data collection research and developing that really strong evidence base to say, if we don't have the evidence, this is how we find the evidence. And what's happened is that there's a huge shift. We realise that this actually plays a space, and we're analysing our data at the moment and looking at what symptoms people commonly present with to our service. And they're the symptoms that really aren't addressed in Western medicine, so fatigue and lack of well-being and complex peripheral neuropathy and other symptoms. So it's really important to look outside the box, and centres around Australia and around the world are building these comprehensive cancer centres, and this is the way of the future, and it's becoming mainstream. And I'm the co-chair of the clinical practice group for the International Society of Integrative Oncology, and I'm the chair of the National COSA Integrative Oncology group, and I think I need to go inside. And I think that it's a really exciting space to be working in, and it's a bright future.
I could talk to you for so many more hours, but you need to go. Judith Lacey, thank you so much for joining us. Dr. Judith Lacey, you're doing exceptional work. Thank you so much for joining us on FX Medicine.
Bye-bye.
This is FX Medicine. I'm Andrew Whitfield Cook. Go.